Welcome back to our pregnancy journey. You've made it to month 3 of 9, and this is a big month. Not only is your baby growing fast, but you might even get to hear that tiny heartbeat for the first time. Ready to find out what's happening in your body and what to expect next? Let's dive in. What's happening inside your body? By month 3, your baby has grown from the size of a blueberry to a plum. But here's the really exciting part. Your baby is no longer called an embryo. They're officially a fetus. And guess what? By now, your baby's heart is fully developed and beating at around 150 beats per minute. That's about twice as fast as your own heart. You might even get to hear that heartbeat during your next prenatal appointment. Your baby's organs are starting to function, tiny fingernails and toenails are forming, and their reproductive organs are beginning to develop. Though it's still too early to know if you're having a boy or girl. Symptoms you might be feeling while your baby is growing: your body is going through some changes too. Here's what you might be feeling in month 3. 1. Nausea may peak this month, but the good news is that it often starts to ease by the end of the first trimester. 2. Frequent urination continues as your uterus expands. 3. Breast tenderness might still be intense as your body prepares for breastfeeding. 4. Headaches and dizziness, due to hormonal shifts and changes in blood pressure. 5. Visible veins, your blood volume is increasing, making veins more prominent, especially on your chest and belly. And don't be surprised if you feel a little more emotional than usual. Those hormones are still doing their thing. What should you do in month 3? 1. Schedule your first ultrasound if you haven't already. You might get to hear that heartbeat. 2. Discuss prenatal screening tests with your doctor to check for any potential health concerns. 3. Continue with your prenatal vitamins, especially folic acid and iron. 4. Start thinking about maternity clothes. You might notice your regular pants feeling a bit snug. 5. Stay active with safe exercises like walking or prenatal yoga to support your health. When to call a doctor? Most symptoms are completely normal, but here's when you should call your healthcare provider. 1. Severe cramping or abdominal pain. 2. Heavy or bright red bleeding. 3. Blurred vision or severe headaches. 4. Sudden swelling in hands, face, or feet. If you experience any of these, don't hesitate to reach out to your doctor. It's always better to be safe. Fun fact: did you know? Here's a fun fact. By the end of month 3, your baby can make tiny movements like kicking and stretching, but you won't feel it just yet. They're also starting to develop their own unique fingerprints. Stay tuned for month 4. That's everything you need to know for month 3 of 9. In month 4, your baby's growth will speed up even more, and you might even start to feel those first tiny flutters. Make sure to subscribe and hit the notification bell so you don't miss it. See you next week.